that is a very important question, because I think until we have the vaccine and therefore can administer it to a great percentage of the population and therefore induce immunity within our population, we're going to be at risk for having increased transmission and possibly surges. And so when that's going to be available, as you know, from at least for the CDC and from the National Institutes of Health recommendations, they say about a year to 18 months. Now, quite honestly, that may sound like a long time, but if you look at the history of vaccine development, that's actually fairly short, because in the past, the vaccines, which are really important in being able to control virus infections. I mean, when you think about measles, when you think about other infections, even like polio and childhood viral infections, that has been the primary way by which we've been able to control viral infections, is by the development of safe and effective vaccines. But usually they have taken years to develop. So if we can get one within 1 year, I think that's going to be a great possibility for us to be able to control this particular infection. Well, the treatments for COVID-19 are going to depend to a great extent on how sick a patient is. Now remember, 80% of the patients who contract this have very mild infection, or quite honestly, maybe no symptoms at all. And for those patients, we're just going to say that, well, you stay home, you can treat symptomatically. If you have a low-grade fever, you can take something like acetaminophen or similar types of medications. Make sure you drink lots of fluids and have good nutrition as well. And usually you're going to get better after maybe a period of 7 to 10 days, like other respiratory viruses. However, we do know that about 20% of patients, they're going to develop symptoms that are severe enough that you might have to come to the hospital. And when we see patients coming into the hospital, which we've seen obviously over the past couple months now, there's various ways that we treat these patients. First and foremost is general good supportive care. That is, if patients need IV fluids, we give them IV fluids, make sure their electrolytes are good. If they need supplemental oxygen, we'll give them supplemental oxygen. We'll give them good nutrition. And again, in most cases, patients will eventually get better with that type of treatment. Now, there are other couple of treatments that we are considering which aren't proven yet. One is specific therapies against the virus. Now, you are aware that we do have specific viral medications or antiviral medications that can treat influenza. We don't have any proven antiviral medicines for this infection yet. However, I know that there are randomized clinical trials being conducted which will evaluate the efficacy and safety of some of these newer medicines. And I'm very hopeful that very soon we'll have these results and we'll be able to use some of these medicines in those patients who are sick enough to come in the hospital, that we can give them an antiviral medication that will be able to treat this particular infection. And then lastly, we do know that part of the problems with the clinical manifestations of COVID-19, at least for patients that come into the hospital, is that they can have, maybe after 7 to 10 days, what we call a cytokine storm. What that refers to is that there's an overreaction of the immune system of the patient that actually can cause damage to the normal organs of the patient, including the lungs. And there are some medicines that are being evaluated that might be able to reduce that as well. So I think over time we're going to have more information based on studies to see how we can use these types of interventions to treat patients. Well, if you refer to mass testing as where somebody can go anytime, any day, I guess, without a physician's order and go to a facility and get a testing done, I'm thinking hopefully by the end of May that will be available in almost most communities. Right now we don't necessarily have that, although we do have some off-site centers, some pharmacies that are developing and making available the test that you can call and get an appointment for. But I'm thinking that probably by the end of May, this will be available to almost everybody if they wish to have the test done.